Your healthcare needs are unique, and so is our offering.
Hospitals have become the most unquestioned place for babies to be born because of the peace of mind they offer. There is, however, a growing trend of pregnant moms who are opting for home births.
Hello ladies, thank you so much for joining us. I can see you both are very far along. What decisions have you made with regards to birth?
I'm going with natural water birth at Genesis Clinic.
Yes, and I'm also doing a water birth with a midwife at home.
So what made you decide on these options?
This is my first child, and I suppose I've always leaned towards, having a natural birth. Not necessarily at home, but just I knew I wanted a midwife and that I wanted to be somewhere that supports naturally with as little intervention as possible. So going into childbirth, a lot of mothers feel that if they do go for a natural, that will involve being in a hospital, lying on their back with a bunch of doctors and they're in a gown, and it's a bright, sterile environment, and we don't need a team of 5 doctors and all of these other people around.
A home birth can be safely conducted under the guidance of an experienced and qualified midwife.
So if I wanted to have a home birth, what are my options?
Well, you would first of all go and see an obstetrician who would give you the green flag as a low-risk woman to go and see a midwife. And then I see women particularly from 12 weeks, and I go through all their options. If, though, you are deemed to be high risk, then of course it's a safe option to have your baby in a hospital.
With conventional hospital births, it's in lithotomy position. What's your opinion on this?
When a woman is in labor, her pelvis becomes mobile. And this sacral area here lifts 2 centimeters up in the air. Her iliac bones go sideways in 1 centimeter in each direction. And all her cartilages are soft like chewing gum so that they can give and spread. If we turn a woman over onto her hands and knees, the sacrum comes up, her coccyx comes back at a 90-degree angle like that, and her baby comes out in one direction. Her perineum, the part that we would take a pair of scissors to in order to do an episiotomy, is lifted when she's on her hands and knees. And a woman is far less likely to tear then if she's on her hands and knees to give birth.
So in the end, it's about what is the best choice for that family.
Yes, and I think it's all about choice, isn't it? That women shouldn't be driven to be bullied to think that hospital is the only way to be safe, but that choices are about healthy births, healthy babies, healthy women, and, like you say, choice.
When deciding on a birth method, it's important to consult with your healthcare practitioners and make an informed choice.
Sharon has discussed the benefits of a home birth, but it's important to remember that there are occasions where in actual fact a hospital birth is more appropriate. A thorough antenatal workup will determine whether your pregnancy is low, medium or high risk. Things to remember such as maternal comorbidities like diabetes, hypertension, smoking, advanced maternal age, or previous pregnancy complications. All these factors contribute to the pregnancy, the delivery process, the well-being of the newborn, and of course the mother. If your pregnancy is classified as a medium or high risk one, it would be most sensible to give birth in a hospital where all the facilities and specially trained personnel like obstetricians, anaesthetists and pediatricians are available should any complication arise. It's extremely important to remember that even a low-risk pregnancy can result in complications within the delivery process. Abruptio placenta is one of these conditions where the placenta actually detaches from the uterus prematurely. Another condition is an atonic uterus, where the uterus doesn't contract sufficiently post-delivery to prevent further bleeding and the mother bleeds out. These complications are completely unpredictable. That's why it's so important that if you do plan a home birth, make sure that there is a rapid and seamless backup plan in place. In essence, home births and hospital births have their place. The key is to be educated about your pregnancy and the choices that you have.
Whether you choose home or hospital, your birth should first and foremost be a safe and special event.
Momentum Health, because one size doesn't fit all.